Violence on women is not foreign to many. Most of us are well aware of what entails the subject and its detrimental effect, and as women, some of us may in one way or the other are victims of such violence. Literature has indicated that around the world at least one woman in every 3 has been beaten, coerced into sex, or otherwise abused in her lifetime. Most often, the abuser is a member of her own family. Increasingly, gender-based violence is recognized as a major public health concern and a violation of human rights. The effects of violence can be devastating to a woman's reproductive health as well as to other aspects of her physical and mental well-being. In addition to causing injury, violence increases women's long-term risk of a number of other health problems, including chronic pain, physical disability, drug and alcohol abuse, and depression. Women with a history of physical or sexual abuse are also at increased risk for unintended pregnancy, sexually transmitted infections, and adverse pregnancy outcomes. Yet, victims of violence who seek care from health professionals often have needs that providers do not recognize, do not ask about, and do not know how to address. Violence against women and girls includes physical, sexual, psychological, and economic abuse. It is often known as gender-based violence because it evolves in part from women's subordinate status in society. Many cultures have beliefs, norms, and social institutions that legitimize and therefore perpetuate violence against women. The same acts that would be punished if directed at any employer, a neighbor, or an acquaintance often go unchallenged when men direct them at women, especially within the family. 2 of the most common forms of violence against women are abuse by intimate male partners and coerced sex, whether it takes place in childhood, adolescence, or adulthood. Intimate partner abuse, also known as domestic violence, wife beating and battering, is almost always accompanied by psychological abuse, and in 1/4 to 1/2 of cases by forced sex as well. The majority of women who are abused by their partners are abused many times. In fact, an atmosphere of terror often permeates abusive relationships. How healthcare providers can join help and help other healthcare providers can do much to help their clients who are victims of gender-based violence. Yet providers often miss opportunities to help by being unaware, indifferent, or judgmental. With training and support from healthcare systems, providers can do more to respond to the physical, emotional, and security needs of abused women and girls. First, healthcare providers can learn how to ask women about violence in ways that their clients find helpful. They can give women empathy and support. They can provide medical treatment, offer counseling, document injuries, and refer their clients to legal assistance and support services. Family planning and other reproductive health care providers have a particular responsibility to help because abuse has a major, although little recognized, impact on women's reproductive health and sexual well-being. Providers cannot do their jobs well unless they understand how violence and powerlessness affect women's reproductive health and decision-making ability. Reproductive health care providers are strategically placed to help identify victims of violence and connect them with other family support services. Providers can reassure women that violence is not something to be tolerated or accepted and must be condemned and discouraged by all means. It is noted that gender-based violence is a significant public health challenge in many countries. Specifically, Violence against women and girls is a mere violation of human rights. It has enormous negative impact on the individuals, communities, and the whole of society. It affects the safety, dignity, and health of people, as well as affecting public health, economic well-being, and the security of a nation. Working women in most instances are more at risk of certain forms of violence, particularly shift workers who work odd shifts such as nurses, midwives, female police officers, etc., etc. The Fiji Women's Crisis Center National Violence Against Women Prevalence Study published in Fiji in 2013 revealed that the rates of violence against women and girls in Fiji are among the very highest in the world. 64% of women who have been in an intimate relationship have experienced physical and or sexual violence by a husband or intimate partner in their lifetime. And 24% are suffering from physical or sexual partner violence today. Overall, 72% of every partnered women experienced physical, sexual, or emotional violence from their husband/partner in their lifetime. And many suffered from 3 forms of abuse simultaneously. The Ministry of Health and Medical Services is therefore committed to working with civil societies and organizations such as Fiji Women's Crisis Center and Pan Pacific, Medical Services Pacific, as well as education institutions and partners such as the Fiji National University and other government ministries, that of the Ministry of Social Welfare, Women and Poverty Alleviation, the Department of Public Prosecutor, etc., to ensure that the violence against women health response is integrated and well placed in a multi-sectoral framework. With the launch of the I Care campaign in 2014, the Ministry of Health and Medical Services has again registered its commitment to strengthening the health response to end violence against women and girls in Fiji. In conclusion, I am certain that the beginning of these 16 days of activism on the elimination of all forms of violence against women and girls, which coincides with the annual Midway-Free Scientific Conference, should instigate and encourage a sense of concern and participation of midwives around the country to strongly advocate for the elimination of violence against women and girls. In launching this campaign on behalf of the Ministry of Health and Medical Services, I wish to highlight there is help available. We must collaborate by joining hands and efforts to create as much advocacy and awareness amongst women and girls to conquer and eliminate all forms of violence against women and girls in Fiji, the Pacific, and beyond. On that note, invited guests, ladies and gentlemen, I am delighted on behalf of the Ministry of Health and Medical Services to officially launch the 16 Days Activism on Violence Against Women, and I wish us all every success in achieving the ultimate goal to end every means of violence forged against women and girls in Fiji. May God bless every woman, girls, and midwives of Fiji, and may God bless our beloved nation.